I'm Indu Subaiya. I'm the co-founder and CEO of Health 2.0. Health 2.0 is a conference and media company and a global community of innovators trying to improve health and healthcare around the world. We've been doing this since 2007, where we started our first conference in San Francisco and showcased some of the coolest new technologies at the time that were using the internet to improve health and healthcare by connecting consumers to each other, by connecting consumers to their physicians, and really improving the efficiency and quality of the healthcare system. And since then, it's grown into a global movement where a number of startups and folks with new solutions and technologies have come together to really penetrate the healthcare system in their respective countries. And I think what we're trying to do now is really pour the gas on, so to speak, to really accelerate this movement, give the entrepreneurs the tools and the resources they need to take their early stage ideas all the way into implementation so that they can reach the scale and have the impact that they deserve. I mean, there's so many amazing things going on in India itself, and I think India is at an interesting crossroads right now to really provide not just support for technologies in other parts of the world through the way India has worked in the past through outsourcing and back office support, but to now play a leadership role and export innovation that's originated here. So we've seen a number of wonderful things coming to prepare for this conference in a number of categories. First, in terms of educational content, there's such a need here to spread basic information about health and healthcare to people with various conditions. And so one of our favorite companies that's going to be showcasing is called Indu. It's a content and information hub for people living in India around all aspects of health, from wellness and nutrition to heart health, and even on issues like sexuality, which is a growing and important concern and health topic for us. There is also a whole category of non-invasive diagnosis and remote monitoring that I think is going to be very revolutionary, both in India, but possibly with implications in other parts of the world. We have folks doing low-cost screening for eye diseases, preventing blindness, and among the 12 million people that have it in India today. We have folks that are developing in their homes, really bootstrapped entrepreneurs. This one company that's taking a portable ECG technology and allowing it to be transmitted remotely so that we can really monitor heart conditions in hard to access areas. In terms of healthcare services, a number of cool technologies connecting hospitals to their clients and to their members, doctors to their patients. We're going to see WellView, which is going to bring a iPad-based visit summary so that patients can walk away with all the information from their doctor's visit. We have a company called Health Highway that's going to allow doctors and in hospitals to connect with patients after discharge and provide them with lots of information and content. And we're even going to have an entrepreneur who's going to tell us about his vision for air ambulances. India has one of the highest rates of road fatalities, and getting access to hospitals in a timely fashion is something that's been a huge challenge in India, and his vision for air ambulances is going to address that. So a lot of just exciting stuff, from content to services to platforms that are just going to open things up and improve quality for everybody here. I think the sheer scale of the population, I think it's a daunting task to think about how you begin to provide quality health care and affordable health care for nearly 1.2 billion people. So I think that's the biggest elephant in the room, is just the sheer number and size of the population here. That said, there's so much development and acceleration of innovation from tertiary care in cancer centers. It's leading the world in some of these new types of hospitals and facilities, all the way down to sort of low cost and basic care using mobile technologies. With 900 million Indians with access to a cell phone, that's a huge opportunity. So I think there are barriers just reaching large numbers of people, but also an increasingly networked set of systems and hospitals that are world-class, that can then build extensions to their services to reach folks in everyday environments, not just when they get to the hospital from being sick. So I think one of the other challenges is the different sort of demographics in the population. You've got folks who can pay for some of the best care in the world, and obviously folks living well below the poverty line. So how do you make a service available to across the spectrum of people who can afford afford and not afford to pay. We have people like Dr. Devi Shetty, who is making heart surgery available at $800. This is unheard of in any other part of the world. So he is committed to taking a very expensive procedure and making it broadly available, but I think that will be a challenge across the board as we progress. I think there's so many places. I think starting in early life with infant mortality, nutrition, maternal and child health. India, I was just reading, has one of the highest rates of stunted children. I think we rank next to Yemen and the Congo for just poor nutrition. So I think we talk so much about advanced health and advanced care and very fancy procedures, but I think the chance to make the biggest impact is in some of the basic healthcare needs. And so I think nutrition, infant health, maternal health, I think there's so much that can be done there. And then once that basic foundation is there at the start of life, hopefully it continues and has beneficial impacts as people get older and grow.